Hair matters. Thick, glossy hair signifies vitality and attractiveness. But what happens when our hair starts to fall out?
I always put a huge amount of pressure on myself to look perfect. But since going bald, I feel reborn.
Hair is sensitive. Genes and hormones influence how it grows or vanishes.
I'd say male pattern baldness affects at least 80% of all men.
An increasing number of men are choosing to get hair transplants.
I'm treating myself to this little luxury. I can't imagine being bald for the rest of my life. Not yet.
Healthy hair can be extremely strong.
My hair is plentiful enough, relatively strong, and able to suffer some abuses.
How much influence does our hair have on our life? And how do we feel if our hair changes?
What most people don't realize is that we're constantly using our hair to communicate. The hairstyle we choose can send out all sorts of signals. What social groups do we want to belong to? How young do we feel? Or how old? Our hair sends out a message that's instantly recognized. I'm Ralph Paus. I'm a professor of dermatology at the University of Miami in Florida, and I've been researching hair for over 30 years. The fact is, we immediately recognize something about the people we come into contact with just by seeing their hair. That's significant, of course. If I suddenly no longer have control over this means of communication because I've suddenly lost it, I also lose part of my control over myself. And that's very difficult to accept for those who are affected.
I was 25 when I first noticed that my hair was starting to fall out and become thinner, that more hair was coming out in my comb. At first I wasn't too worried, but it gets a bit frustrating when it doesn't stop. I don't want to shave all my hair off, as I've always liked it, and I don't want to go bald. That's the worst-case scenario, so I'm going to try everything I can before that happens. I'm Olaf Schäfer. I'm 41, a nursing services manager, and I'm planning to get a hair transplant. I started going bouldering more or less regularly about 10 years ago, with breaks when the kids came along. I've been with my girlfriend for 11.5 years and have 3 kids. I want to have this operation because I'm actually quite vain. I like to see myself as a bit younger than I am. That's my main motivation. I'd like to keep my hairline as it is, I think. I don't want it to be too much lower. I'd just like it to be a bit thicker, also towards the back. For me, thicker hair looks youthful. People with sparse hair or no hair look older to me. I'm completely open about it. I think if there's a possibility, why not go for it? Hair transplants have become kind of socially acceptable since celebrities started having them done. I know at least 2 or 3 people in my circle who are also planning to do it. I'm kind of the guinea pig, so they can see if it works or not.
bin happy, so wie es
I'm
ist.
happy the way I am. I don't miss my curls.
Seitdem ich eine Glatze habe, bin ich general überholt.
I always say that since I went bald, I've been reborn. I'm full of power, I'm happy, I feel more feminine than ever. I really developed a new kind of energy.
Einfach, ja, so eine neue Lebensenergie zurückbekommen. Mein Name ist Sharon Baptiste, ich bin 32
I'm Sharon
Jahre alt
Baptiste.
und arbeite als
I'm 32, an actress, and I suffer from alopecia areata, or spot baldness. That means I have uncontrolled hair loss.
Unkontrollierten Haarausfall habe, den ich nicht
I know that there are other types of this disease where people lose all the hair on their bodies.
Sprich, dass Menschen gar keine Haare mehr am Körper
For
haben.
me,
Bei mir ist jetzt
for now, it's just the hair on my head. It took so much of my energy and made me sad throughout most of my youth.
Meiner Jugend traurig gemacht, weil es schon
Part of me was broken, ashamed, and I really felt like I was somehow a bit different.
Ich vor allem gespürt habe, dass ich da vielleicht so ein bisschen anders bin.
Hair loss diseases affect people's psyches much more than one would think. It's only when you experience it yourself or someone in your family suffers from it that you realize how fundamentally it can affect people psychologically. So we should be extremely careful not to trivialize it.
Ist geradezu sträflich.
My hair is important to me to the degree that it's a piece of equipment that's necessary for the work that I'm doing. It's not something that I feel very sentimental or precious about. It's like a trapeze bar, a rope. It's something that needs to be attended to. I don't think that my hair in particular is special or like uniquely talented. I think it's more my overall persona and artistic practice. Hi, I'm Laura Stokes, and I'm a performance maker. I'm from the USA originally, but I live in Berlin now.
My name is Tay. I'm a performance maker. I'm from London. I trust my hair with my life. I can't imagine feeling like it's not going to be able to hold my weight.
I don't have a really particular or like rigorous hair care program. Pretty much use no products, shampoo it as little as possible with a very gentle shampoo. I would say that it just feels the best. It feels the healthiest when I do the least with it. Also, I've stopped like coloring it or cutting it significantly.
Haarfärben ist tatsächlich eine Maßnahme.
Hair dye is something that really does fundamentally damage hair. It's not just about hair dye. If I blow dry my hair with too much heat and it starts to smell, it's basically like frying a steak in a pan. And I shouldn't be surprised when there's hair breakage. UV light is bad for your hair, salty water is bad for your hair, dry air is bad for your hair. These are all factors that have a negative impact on hair structure.
Die Qualität der Haarstruktur haben.
I think I will be a little less sensitive about my hair after the operation, or maybe my vanity will be a bit more satisfied.
Expectations vary when people come to my hair clinic. Sometimes they are unrealistic. It's my job to manage those expectations, because everything is not always possible. Sometimes it's not possible to do the hair transplant at all, if there are not enough donor hairs on the back of the head.
Mein Name ist Dr. Andreas Finner.
I'm Dr. Andreas Finner. I have a dermatology practice in Berlin, and I specialize in hair diseases and hair transplants. I hold daily hair clinics and do hair transplants on the premises. What would you like to have done? What bothers you the most?
It's mainly the front of my scalp. Maybe something can be done there to make it a bit fuller.
Okay, I'll examine your hair now.
Okay.
This is
the first time a doctor has looked at it and can tell me what he thinks could realistically be done.
Was denn wirklich realistisch auch umsetzbar ist.
Look how easily they come out. Luckily, I can't pull out a lot more at the same time. This is typical for male pattern hair loss, where the hair up here is sensitive and weak at the roots.
In hereditary hair loss, the hair follicle is hypersensitive to dihydrotestosterone, or DHT for short. DHT causes the hair follicle to shrink and the hair to grow more slowly and become increasingly thin. Eventually, hardly any hair grows through the scalp and the affected area appears bald. The sensitivity of the hair follicle to DHT depends on genetics and on the follicle's location on the head. Hair follicles from the back of the head are suitable for transplantation.
We made the surprising discovery that ultimately all our hair responds to male hormones, even the hair at the back of the head, but there it acts differently. It's by no means the case that it's completely insensitive to male hormones. It just doesn't respond by becoming smaller.
The preliminary examination for hair transplantation focuses on what is already there. On the one hand, this means determining the size of the area to be transplanted, but it also means assessing the thickness and quantity of the donor hair, because the quantity is limited. After all, it won't grow back if I remove it from the back of the head.
Der Vorderkopf, dieser Bereich, wo die Leute einen wahrnehmen,
the front of the head, which is the area people noticed most, is crucial to your future appearance. And since the amount of hair that can be transplanted is limited, I would suggest that we thicken the front and middle areas of the head with hair taken from the back.
Mit Haaren, die hinten entnommen werden.
But you don't take a noticeable amount from the back, right? There won't be any bald patches.
That depends on whether the neighbouring hair stays in place when I remove a hair.
And if it doesn't, what would happen?
So if it goes wrong, they grow poorly, or if the direction is wrong, it looks strange. It's also important not to implant the hair in a straight line. The hairline needs to be irregular at the front, because that's how it is naturally. It shouldn't look like it's been drawn with a ruler, or that it has been implanted. And the hairline should not be too low, because that uses up too much hair at the hairline. They are better implanted further up.
And how much will be made fuller, approximately?
It will go up to about here. So roughly where the ears are, this line, it will go up to there.
Wo die Ohren sind, diese Linie, bis da geht das dann.
I'll show you again in a photo from above. And here you can see again that it's quite a large area that will be thickened. It goes to here at the back and is made denser everywhere here. How do you like that?
I think it's good.
Better than now, for sure.
Definitely, yes.
In Olaf's case, we have decided to treat the front and middle of the head for practical reasons. This will allow us to harvest at least 1,500 grafts. These are small hair families or groups of 1, 2 or 3 hairs that come from one root. So 1,500 grafts corresponds to approximately 4,000 hair roots. This is a realistic number, and we can be confident that we will not make any mistakes in the long run.
Tatsächlich habe ich auch ein bisschen Angst vorm Eingriff. Ist halt eine Operation.
I'm a little bit afraid of the procedure because it's an operation, and an operation can always have complications. It could backfire.
Auch sozusagen nach hinten losgehen.
And if the hairs don't grow as hoped, then they will be missing at the top and at the back.
Oben und hinten.
Eine Haartransplantation als solche ist ja kein
A hair transplant as such is not a causal treatment.
Kosmetischer Eingriff.
It's a cosmetic procedure and therefore cannot change the underlying problem of hair loss. In fact, many transplant surgeons recommend that their patients continue to take medication after the hair transplant. This makes perfect sense, because it at least delays the decline of the hair that's been transplanted.
The most commonly used medications for hair loss contain the active ingredients minoxidil and finasteride. While minoxidil works primarily by increasing blood flow to the scalp, finasteride works by lowering DHT levels. Both Most medications combat hair loss only as long as they are taken. As soon as the treatment stops, hair loss returns. And they don't work for everyone.
Das ist überhaupt das Kernproblem, sowohl von Finasterid.
That's the main problem with both finasteride and minoxidil. Although a significant percentage of patients respond positively to these medications, a very large percentage do not show a cosmetically satisfactory response. And we ultimately cannot really predict who will be among the lucky ones and who will not. That is, of course, not ideal for any medication and makes it imperative that we develop better ones.
Bessere Medikamente entwickeln.
I have suffered from alopecia since I was 8 years old. I used to have lots and lots of curls on my head. And then it started with round bald patches appearing again and again, about the size of a €2 coin. My loved ones, my family, supported me a lot. I remember that my grandmother took me to see lots of doctors, and of course my mother did too. We went to different clinics and hospitals. I had various tests done. At that time, no doctor could tell me, this is what it is.
I know we went to a dermatologist at some point, but by then you were maybe 10 already.
But I think it wasn't until I was a teenager that I really learned the term circular hair loss, alopecia. So, at some point I noticed that some of these patches were starting to grow back. It's the kind of thing you're happy about for a moment, but then you understand. Okay, but in another place on my head it's still going on. That's the thing about this disease. Suddenly you have a flare-up and your hair falls out. And the next day some hair grows back in a place that had been bald for 3 years. I just had an incredible number of questions. What else can I do? Does it come from inside me? What's wrong with me? What am I doing wrong in life that it keeps coming back?
And that's the worst part. I always found that difficult. When a flare-up started, you would be devastated, and it was always a process of building you up again, always starting over and saying it wouldn't be that bad. And every time the patches got bigger.
I often felt like, maybe someone could just tell me what I can do, what I should stop doing, and what the problem is. Many doctors blamed it on my mental health. And I would say that's the most common thing I've heard, that it's due to stress and that I need to work on my mental health.
When patients go to the doctor with a problem for which there is no quick pill or something that can usually be done in conventional medicine, practitioners often use stress as, let's say, the diagnosis of last resort. So they're basically saying, I don't have anything I can give you in the form of a pill, so it must be stress. That never really works. Actually, in medicine, it should be taboo.
My name is Eva Peters.
I'm a psychodermatologist, which means I specialize in dermatology and psychosomatic medicine. And I'm also a professor of psychoneuroimmunology at both Justus Liebig University in Gießen and the Charité Hospital in Berlin. Hair is my core topic, and I've been studying it for years. On questionnaires that measure stress, depression, anxiety, traumatic experiences, etc., hair loss patients often score just as badly as patients with completely different conditions that we would usually consider more serious or significant.
Meine erste Erfahrung mit Panikattacken hatte ich tatsächlich nach
I actually had my first panic attack after visiting a dermatologist because he was honest and told me, Miss Batiste, you may always have bald patches. You may eventually lose all your hair. You may eventually lose all the hair on your body. Have you ever considered wearing a wig?
Haben Sie sich eigentlich schon mal mit Perücken auseinandergesetzt?
It is often a life-changing experience to be diagnosed with alopecia areata. It can even cause real trauma. You learn that you have a condition that can lead to total hair loss and for which there is no effective treatment. That's often quite a blow for patients.
Es war schlimm, weil
wow, that was awful, because at that moment, a lot of things go through your head. You think, okay, how can I still live as a woman? Women have long hair, and I already look different anyway, and now I won't have any hair left. Many, many bad thoughts went through my head.
Viele, viele schlimme Gedanken in meinem Kopf.
Practically everyone feels the effects. Perhaps a third of patients cross the threshold into mental illness. People like to trivialize it. Hair loss isn't fatal after all, but when it drives someone to thoughts of suicide, hair loss can actually kill them.
Ich habe natürlich viel probiert. Ich hatte damals
Of course, I tried lots of things. At the time, I had ointments that I applied to these areas. As a child, I sometimes had cortisone injected into my scalp, which was incredibly painful. I tried pills, I tried therapy, I tried a tincture.
Ich habe es mit einer Tinktur probiert.
The question is more, what didn't I try?
Ich glaube ich nicht probiert.
Die Alopecia areata ist eine Erkrankung, bei der das Immunsystem
Alopecia areata is a disease where the immune system attacks this mini organ, the hair follicle. To date, there's no causal treatment for alopecia areata that can eliminate the disease once and for all. All the therapies we have today just treat the symptoms. They suppress the immune system's response to the hair follicle. For reasons we do not yet fully understand, it's very, very important for the growing hair follicle not to be recognized by the immune system. And this fascinating principle of hiding in order to function better and not be attacked is one of the most exciting areas of research in hair science today.
In order to hang by it, we have to do a special preparation, which requires quite a bit of brushing and combing to get all of the hairs even. I have to have my head down when I'm preparing it because all of the hair needs to move in this direction in order to then hang from it. So obviously I need to be down, getting it in that direction. It's important that you have really even pressure all around. It needs to be evenly distributed so that you have the weight of your body evenly distributed, that you don't have one part of your hair that's like pulling a significant amount more. Traditionally, the hair has been, I think, super wet for hair hanging. Hair is stronger when it's dry. However, it's more flexible when it's wet. The wetness helps the hairs all like get into like line together.
Wet hair is more flexible because water dissolves some of the chemical bonds that give hair its structure. That's why wet hair is also longer. When the hair dries, the bonds close again. The structure of hair resembles a cord. Each hair consists of many long protein spirals that are twisted multiple times. This makes it incredibly stable. A single hair can hold up to 100 grams without breaking.
Es gehört zu den faszinierendsten.
One of the most fascinating observations about hair shafts is that they have an incredible load-bearing capacity. These protein strands are among the most stable things nature has invented.
Then I affix the whole preparation in the braid.
Historically, the way of braiding the hair for hair hanging has been a secret within the circus community.
I don't think I'm telling all the secrets. I hope not. The first time that I tried it, and it felt crazy, absolutely crazy. Not even necessarily painful, but like terrifying, where you're like, oh my God, my scalp might rip off. It's just such a totally new and different sensation. And it took me quite a while of like slowly working with that sensation before I got to a place where I was comfortable with it.
It's difficult to describe the feeling of hair suspension or hair hanging. I think it's pain that's famously difficult to describe, and it's not just pain, but there's lots of sensations.
The fact that we're both hanging by our hair necessitates that we have the same level of sensitivity and the same limitations. You know, you wouldn't imagine it, but it does actually hurt a little bit. But it just feels great. It feels super freeing. You have all of your faculties. I mean, it's not reverse gravity, but there's something very different about being anchored from the head and having the like freedom below that. When I first started hair hanging, the kind of performance that I was doing was like quite fragile. Years later, I'm familiar enough with how my body moves in a hair hanging situation that I can do much more dynamic and unexpected movement and feel safe doing that.
The trick here is that the load is distributed across a large number of different hairs. We have 100,000 tiny hair factories in our scalp. And if I distribute this enormous tensile load across thousands of hairs, it can work well. What you should never do is put your hair under chronic tension, because that damages the biofactory.
Good morning, hello.
Good morning.
Let's get started. Feeling nervous?
Yes, I'm nervous.
That's normal. You'll calm down later, when you realize everything's underway. Come here and we'll draw in the hairline again. When drawing in the hairline, I pay attention to the shape of the head. For example, you shouldn't implant the hair on the forehead where there is a steep wall, but on top of the horizontal plane, where the hair can lie flat.
I think that's good if it's doable.
Then I'll trim the hair at the back.
Now it's getting serious. This is a decisive moment.
I'm not cutting yet.
How short will it be at the top? How many millimeters?
I set it to 4. There are also techniques where this is done without shaving, but then there is a greater risk that the hair will be damaged or cut at the roots.
Very strange. From very long to very short.
This closely cropped hairstyle is of course a shock for many patients at first. It looks quite empty. I think it will look a little better once the hair has grown back.
ist es doch ein bisschen besser.
Yes, I don't really like seeing myself like this. I prefer to have longer hair.
Ja.
I'm mainly afraid that the transplanted hair will fall out again,
Transplantierten Haare, wenn es dann dazu
and that I'll end up with less hair overall.
wieder ausfallen und dass man dann
So no visible success.
also ohne einen sichtbaren Erfolg.
Die oberflächliche Antwort auf die Frage,
When patients ask whether the transplanted hair will remain there for life, the answer is yes, in theory. But in practice, that's not quite the case. Because, first of all, hair ages. The growth phase becomes shorter, and the hairs can also become slightly thinner. This also happens to hair that's transplanted from the back to the front. So there's no guarantee that it will remain completely intact for life.
The operation is performed using a method called FUE, or follicular unit extraction. This involves removing several thousand hair units using a hollow needle. Each hair unit contains up to 5 hair follicles from the back of the head. The hair units are temporarily stored in a nutrient solution. Small recipient channels must now be created in the bald areas of the head. 1 hair unit is then placed in each recipient channel.
The whole procedure takes 6 to 8 hours, usually under local anesthesia. The surgeon must align the micropunch with the angle of the hair. If the hair root is cut during removal, there is a risk that it will not grow back completely. Or if I want a triple transplant, for example, I may not be able to remove all 3 roots. Then they'll be missing when I go to transplant the hair.
Wenn ich ein Dreier-Transplantat möchte, nicht alle 3 Wurzeln heil rausbekommen und die fehlen mir dann natürlich in der Haarmenge zum Transplantieren. Bei den Transplantaten, diese kleinen...
We have to make sure that we don't crush these grafts, these little seedlings, when we insert them, or when we remove them with tweezers. And they must not be allowed to dry out, because that would be harmful to the tissue.
Das wäre natürlich fürs Gewebe dann schädlich.
Once the hairs have been removed, they are sorted into groups. This means looking at where there is 1 root in the graft and where there are 2, 3 or 4. The smallest ones are planted at the hairline, the larger ones behind them. They have to be sorted accordingly.
I can hear every cut very clearly.
The temptation would be, of course, to make it nice and even up front, but that would be a mistake. Nature isn't straight, it's irregular. The trick is to imitate that. If I don't pay attention to that, it will look strange afterwards, like it's been operated on, or it might even grow poorly.
Dann sieht es nachher komisch aus, operiert aus oder wächst sogar schlecht an. Entscheidend ist, dass die Wurzel gut
It's crucial that the root grows well, that it's absorbed into the bloodstream, and that its growth is not disrupted by anything.
Wenn die Operation gemacht ist, muss der
Once the operation is complete, the patient also has to be careful, because the hair is not yet firmly rooted. So it's very important not to scratch or rub the area for the first 1 to 2 weeks. You have to be especially careful during the first few days. But patients do tend to be careful. They don't want their hair roots, which have been so nicely implanted, to slip out again.
The number of hair transplants has exploded in recent years, and in theory, in cases of alopecia areata, hair could be transplanted, but it would be completely pointless to do that, because the transplanted hairs would then be attacked by the immune system in exactly the same way, so it simply doesn't work.
Vor 3 Jahren war ich emotional und mental.
3 years ago, I was in such a difficult emotional and mental state that I lost a lot of hair after having COVID. Nothing could be saved.
Also man konnte auch nichts mehr retten. Ich konnte kein normalen
I couldn't put my hair in a ponytail anymore. I couldn't shift it from left to right. I couldn't hide it with a hairscarf anymore. Over 50% of my hair was gone, both in length and volume.
Und
And I had really reached a point where I realized I'm not happy living like this anymore. And suddenly I had these loud words in my head that kept repeating, I want to end this disease, I want to end this disease. Because I didn't want this hair or this illness to define me. Then I called my 2 best friends and said, I think the hair has to go, now. Let's do it now. I'm ready. But we really have to do it now, because I was afraid that I might change my mind. And then I went to the bathroom and I had my hair shaved off.
Und dann wurde mir der Kopf rasiert.
Man sieht ja noch gar nicht. Ja. Hast schon geschafft gleich, ja.
Also ich hatte während
I had panic attacks back then. I cried. I still get emotional today.
Ich glaube, man stellt sich manchmal strafbar.
Aber mit dem ersten Blick in den Spiegel,
as soon as I looked in the mirror, I felt like I was back. I was here. I had my zest for life back. It was like being reborn.
Ja, aufgeladen.
My girl said to me, your shoulders suddenly straightened up, you were beaming, and you immediately had your sparkle and power back. Believe it or not, my worries immediately disappeared.
Waren sofort weg.
Erst in dem Moment, wo diese Entscheidung in ihr so gereift ist, zu sagen.
That was when she decided, this is a look, a presentation of myself that I would like to have. It was wholehearted. I don't have any hair, but I can still go through life with confidence.
Selbstbewusst durchs Leben gehen.
And at that moment, I thought, oh my God, why didn't you just do it years ago? Maybe it had to be. But I was back to being me again.
The moment we take agency, we decide for ourselves how to shape our own life. That's a very important moment. It can pull us out of hopelessness and the feedback loop of stress.
Also ich würde sagen, ich habe ein Perücken.
Well, I would say I could do a PhD in wigs. I have artificial hair, synthetic hair, real hair. I have everything in my repertoire, from long to short, blonde, black, red.
Also Stand jetzt.
I think I currently own over 20 wigs.
Über 20 Perücken. Also wenn ich morgens
So if I wake up in the morning and think, today I want to be blonde, then I'm blonde. Or I might feel like having red hair. Sometimes I also feel like having bangs and short hair. For me, it's like, which socks should I take out of the sock drawer today?
heute aus dem Sockenfach.
When I'm invited somewhere, people never know. What will she look like today? It's always a surprise.
Die Operation ist 18 Tage her.
It's been 18 days since the operation. The first few days were pretty exhausting. There were a few things I had to remember. Only wear button-down shirts, so you don't have to pull anything over your head. Don't bend over, which is pretty difficult with 3 children. Scabs form and it itches a lot. It's worse at night, and you have to be careful not to touch it. From the 4th day onwards, I could wash it with mild shampoo. That was until the 14th or 15th day. Now I can use normal shampoo, but of course only patting, no scratching, no rubbing. That actually all worked quite well.
So richtig hinzufassen in den Haaren traue ich mich seit ungefähr.
I've been daring to really touch my hair for about a week now, since the scabs came off, and I feel like it's getting more stable.
Stabiler wirkt.
Wie im Garten wächst natürlich nicht jedes.
Not every hair grows, just like not every plant grows in a garden. But if the procedure was done well and no mistakes were made afterwards, over 90% usually grow.
Wachsen in der Regel über 90% an.
Yes, that looks normal. Of course, these hairs will only gradually become thicker and longer again. Here too, it will even out as it gets longer. The skin is getting more blood supply. That's why it's a little redder. There is some dandruff, but wash it as usual and don't worry. Everything will even out.
Waschen Sie ganz normal und mutig, dann wird sich das alles normalisieren.
It feels good. It feels very good, very fluffy. And I'm excited to see how it turns out.
For Olaf,
the next step is to be patient. Not all hair grows back immediately. He will need to wait 6 to 12 months to see the full results. We will then evaluate the final outcome together.
Hair transplantation initially traumatizes the hair that's been moved from the back to the front. And then the hair typically says, okay, now I'm not going to grow for a while. I'm entering my resting phase. Only when it enters the next hair cycle, the next growth phase, will a beautiful new hair shaft be created. Because by then this biofactory will have gotten used to its new surroundings. It says, now I'm fine, now let's make another hair shaft. That takes a few months.
Our hair changes over time, and so do we, throughout our entire lives. Hair can do incredible things, but it can also be a burden.
You can learn to accept the disease. You can learn to let go of catastrophizing. You can work on resolving the conflicts that might be triggered.
I deliberately appear this way in public because I want to show that you can love life even with an illness, that it can be exciting, that it can be thrilling, and that you can achieve anything even if you're bald, whether you're a woman, a man, or a child.
Scientists still face major challenges.
The fact that there are still so few effective drugs is largely because research into the human hair follicle is not nearly as advanced as it needs to be. But research costs time and money, and someone has to be willing to invest in this area.
Our hair can withstand a lot, and sometimes it can even carry us.
It feels great to float through the room just hanging by my hair.